Ask your treatment provider about the possibility of you getting unevenness with the filler or any lumpiness.
I started noticing these really harsh dimples forming underneath my eyes.
I went to Dr. So-and-so and they dissolved the filler. You know, they destroyed my tissue.
The area where they extracted the fat, however, developed lumps. Number 1. Filler is used to fill the gaps created as we age by a loss of fatty tissue in the skin. So it's often used to deal with hollow cheeks, if we want fuller lips, to deal with our nose to mouth lines, also known as nasolabial folds. It can improve our chin. Do you know the singer Ariana Grande?
Ariana Grande, yes.
She's got a beautiful jawline, that's how I would like my jawline.
We can do with the filler if you want.
Point number 2, fillers can also be used to rejuvenate the back of our hands, and restylane, which is made of hyaluronic acid, is commonly used for back of the hand rejuvenation. Now, speaking of hyaluronic acid, there is a plethora of fillers on the market nowadays. You can get ones made, as I say, from hyaluronic acid, like restylane, that comes from QMed, like Juvederm, that comes from Allergan, and like Teosyal, and I've had all of those and I've been happy with all of those. You can get Radies, calcium hydroxylapatite. You can get Elance, polycaprolactone suspended in carboxymethyl cellulose, and the carboxymethyl cellulose takes the form of tiny microspheres. You can get collagen, that comes from animals, and many, many others. So keeping that in mind, number 4, ask your treatment provider what filler they plan to use on you and why. Number 5, ask how long the filler will last. Now, on that note, point number 6, collagen, which comes from animals, is one of the least lasting fillers. In some cases, it vanishes in less than a month. Also, regarding collagen, point number 7, as collagen comes from animals, customers have to have an allergy test performed on them before they have the treatment. In contrast, synthetic fillers like hyaluronic acid ones don't require an allergy test. Number 8, most fillers other than collagen last 6 to 12 months, some last longer, and a few are said to be permanent. Number 9, you can get a range of people doing fillers: nurses, doctors, dentists and beauty therapists. Number 10, relating to point number 9, costs of filler treatments vary from practitioner to practitioner and from location to location. I think probably the most expensive place to have your filler done in England is in the Harley Street district of central London. Number 11, ask your treatment provider about the possibility of you getting unevenness with the filler or any lumpiness. Number 12, ask how the filler will feel to the touch. Now, I can tell you that Radies, my favourite filler, is actually very palpable to the touch. But I can also tell you that for me, it's always looked good and it's always lasted well, and its palpability has no impact whatsoever on the visual enhancements that it offers. It's my number 1 filler. Number 13, ask about the possibility of bruising arising from your filler treatment. I've never had that, but you never know. Number 14, you're likely to get a little bit of swelling with your filler treatment, but that shouldn't last any more than a day or 2. I still think it's worth you raising the matter with your treatment provider anyway. Number 15, ask how likely the filler is to migrate from the site where it's injected. You don't want it to migrate.
After 4 years, I did have to get it dissolved because I did notice it migrating outside of my lips. The top lip was just getting bigger, like it started to like move out like that, which means there's migration in there, there's filler where it's not supposed to be. So yeah, the lip filler is going to migrate. You will have to dissolve it eventually.
Number 16, ask about the possibility of the filler spoiling an area near to where the filler's been injected. Cheek enhancements done with filler may sometimes make your tear troughs, the curving lines underneath your eyes, appear more noticeable. I've actually never had that, and I've had cheek fillers for years now. But for some people it does, it makes their tear trough stand out, and you want to avoid that.
Fillers attract water. So by nature, you're putting something in a delicate area that's going to attract water and give you a baggy looking eye. And that is a disaster.
The nature of hyaluronic acid fillers is that they are hydrophilic. That is, They love water and attract many times their weight in water with time. What you see immediately after the injection is not a true result. My patients will come back later with puffiness and overfilling as the filler hydrated.
It never really got to a point where I really was like satisfied with it. I had to go back a few times to get it like sort of evened out.
The past like year, I started noticing these really harsh dimples forming underneath my eyes, and I spent the past 3 months going in again and again and again and again.
Number 17, ask if the filler that you're getting can be reversed. And if it can, ask how it's done and ask about any potential drawbacks with having the filler reversed.
I went to Dr. So-and-so and they dissolved the filler. They destroyed my tissue. Now I'm all, deflated. And the reality is that because these products are very hydrophilic, they expand. And once you get rid of the product, the tissue looks deflated and these patients are not happy.
I'm Gina, I'm 46, I am from London, England. Another way that you can fill in the gaps in your face, cheeks, lips, chin, nasolabial folds, is with fat transfer. So if you are having a liposuction procedure and you've got some hollows in your face that you want to fill in, then that's an ideal occasion to have it done, because then, as you can see, they can use some of the fat that they're going to extract from you in your fat transfer. You can also just have fat extracted specifically for a fat transfer to your face. They do a small liposuction job, or in some way they extract fat from your body. Now I had this done in 2010. They extracted some fat from my abdomen for my fat transfer. The area where they extracted the fat, however, developed lumps underneath it. It was really lumpy and thick. Now you couldn't actually see it, but I could always feel it. For instance, when I was having a shower or when I was putting body lotion on my body, and it wasn't nice, and nobody had told me that that was a potential side effect of having the fat extracted from there. Luckily, many months later, the lumpiness went away by itself. As I mentioned, Radiesse is my favourite filler because it looks great and it lasts well. What you're currently seeing in my cheeks and in my nasolabial folds is Elance. That's polycaprolactone suspended in carboxymethyl cellulose, which takes the form of tiny microspheres. Because the last time I went to have my filler and Botox done, which was around a year ago now, I'm recording this video in January 2022. The lovely lady who I usually go to didn't have Radiesse, but I'm happy with the Elance. It looks good and it lasts well. This is a year old, as I say, and I still think my cheekbones are looking quite good. A bit hard to tell from this video, I know. I'm sort of shifting my face around, trying to give you the best angle. I'm trying to give myself the best angle. I think they look fine. I think I've got volume in my mid-face, which is what I use the filler for, as well as having a little bit more accentuation done to the contour, the outer contour of my mid-face. My nasolabial folds, well, they're obscured by my foundation, but they're quite faint. They're not really noticeable, in my opinion, even when I haven't got my foundation on. If you've enjoyed this video, then I recommend you to watch this one next. I'll meet you there.